We are Forsyth County Birth Stories, and we are using the power of community story sharing to stop the deaths of Black and Brown moms and babies. Together, we've learned that people want to tell their stories. Families want the opportunity to tell their birth story, especially to people that would listen with respect, dignity, and understanding. So many of the stories are extremely traumatic for generations of birthing people in the community. We found that there is healing power in sharing with one another. We also realized that having additional support from a licensed clinical therapist has been critical in our story sharing process. Using the spheres of influence, we've uncovered themes, including the importance of provider behavior that is respectful and culturally competent, finding accessible resources, the deep influence of family beliefs and tradition in this intergenerational work, and the lifelong lasting effects of personal traumas, thoughts, and emotions. Through our work, we have also learned that we can identify solutions together and protect and garner trust in our community. We can identify allies from our family and friends to local community organizations, to providers, institutions, and legislators to help us pursue better birthing and postpartum experiences and outcomes for Black and Brown families in our community. Our work began in 2021 in response to a funding opportunity posted by Kate B. Reynolds Charitable Trust, a foundation located in Forsyth County, North Carolina. They put out a call for proposals to help organizations convene and develop community-informed action plans for closing racial disparities and infant mortality rates in the county. Let's hear more from Chanel McClurkin Thompson, Senior Program Officer for Local Impact in Forsyth County at the Trust.
As a Black mother of two adult daughters, one of the things that's really important to me is that there is a community where my daughters are safe to deliver babies. Data tells me that it does not matter that they are college graduates, their income is not taken into consideration. The fact that they are Black bodies delivering babies means that they are a much higher rate of dying during the birth of children. As a mother hoping to become a future grandmother, I want to ensure that their bodies are safe as they bring sacred life into this world.
To support the opportunity from Kate B. Reynolds Charitable Trust, we built a strong partnership. It was led by Boston Thurman Community Network, and we brought along some amazing community partners, including the National Birth Coalition, Reset and Heal LLC, and Neighbors for Better Neighborhoods. We were also fortunate to work with a North Carolina-based organization, Population Health Improvement Partners. Boston Thurman Community Network is a local nonprofit committed to revitalization efforts around high quality education, mixed income affordable housing, and community wellness initiatives in the Boston Thurman neighborhood, which is one of the oldest Black neighborhoods in the city of Winston-Salem. It is situated in the 27105 zip code, which unfortunately has had the highest rate of infant mortality over the past 25 to 30 years. And so we knew that we had to be very intentional about not only recruiting residents in the Boston Thurman neighborhood, but in other neighborhoods in the 27105 zip code.
Our work starts with story sharing. Story sharing is a powerful tool that can serve as the basis for any health equity improvement work. Story sharing centers people with lived experiences. In this project, it provides a safe space for story sharers to address structural racism as a root cause of the problem of disparate birth outcomes. Bringing the community together to share stories helps to shift the power, bring insights, build trust, and strengthen community relationships. Story sharing also lays the foundation for change. It provides the groundwork for the community and stakeholders to come together to test changes and drive improvement. Our work has unfolded in 3 phases. In phase 1, we held 4 community sharing sessions with 27 local Black and Brown community members who shared their birth stories with one another. In phase 2, we invited the story sharers back together. We met 3 times to identify themes across their stories, explored opportunities for improvement, and made plans to engage stakeholders and allies. In phase 3, currently underway, we are actively engaging the local public health and healthcare community and other stakeholders to listen and learn from the community members and together prioritize improvements.
Through our work, we have learned the importance of grounding, creating safe space, and providing trauma support. Providing a safe space allows the participants to feel safe while being vulnerable and transparent while sharing their stories. This approach acknowledges current and historical trauma and aims to mitigate harm.
I attended the first Forsyth County Birth Stories listening session because I was eager to start my healing process from the grief, the anxiety, just the traumatized experience that I went through. I was excited to speak to other women about it as well. And we all know that when you're in a group session, that's very powerful, especially when you have someone that's like you, that looks somewhat like you, and they can relate to your story.
Beyond story sharing, we have invested further into the community by creating a small fund for community members who would like to start a local change idea. For example, story sharers may start a peer support group, provide food for community members in the postpartum period, or attend a breastfeeding or doula training. We feel like we have only just begun. After engaging allies, we will be seeking future funding to continue community sharing sessions and associated healing through relationship building. We will pursue several of the solutions identified by story sharers together with allies and other stakeholders. We are looking to partner with a trusted Spanish-speaking community organization to replicate our work with the local Latinx community and continue to explore the power of story sharing as applied to other inequities. If you would like to learn more about our work, please reach out to us. We'd love to hear from you.